It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
Well, in this day and age, we're having all kinds of new maladies because of the technology we have. Handheld devices are causing some issues, and that requires some hand therapy a lot of times. Carrie McCaffrey, a hand therapist from your IRG Snohomish location, going to tell us about that today.
That's right, Tom. Handheld devices, overuse, repetitive trauma of the upper extremities, based on holding these things and working them all day long.
Here's Carrie and Shannon.
Carrie, welcome. How are you today?
Great.
Glad to have you. Welcome to IRG. Welcome to the organization. We're excited to have you, and particularly we're excited because you're a CHT. And I think our listeners, and I know our listeners need to know, hey, what is a CHT? What does a CHT mean? And what is your training? Because it's a very special certification. So tell us about your practice. Tell us about your interest in hand therapy. But more importantly, really talk to us about being a CHT.
Well, a CHT is a certified hand and upper extremity therapist. A CHT can either be a physical therapist or an occupational therapist. They must practice in their respective careers for at least 3 years. In this time, they must have documented 4,000 hours of direct hand and upper extremity care. And finally, they must pass a rigorous board examination to obtain their CHT credentials.
Okay, I just want to review that so our listeners really understand that is you're talking about very specific training in a very specific area. The upper extremities we know are very complex and complicated. We do a lot of things with our hands. And then all this training, 4,000 hours in an area of hand therapy just to sit for the exam.
That is correct. And just to let you know, there are only 6,044 hand therapists across the United States. Just to give you perspective on this, there are 210,000 physical therapists alone compared to that 6,000 hand therapists.
Yeah, that's amazing. I mean, just to have CHTs in our organization, IRG, makes us very proud because, I mean, like you said, only 6,044 in the entire United States, and we have 12 CHTs in our organization. And you're our most recent member that's joined the family here at IRG, and we're excited. You're out in Snohomish. We'll be practicing in Snohomish. You see all kinds of injuries, but also you talked about the experience you have to have, but more importantly, you take a pretty tough test.
Yes, it's a very rigorous test. Unfortunately, there's not a huge pass rate. So you know when you are working with a certified hand therapist, you not only have the clinical expertise, but the experience as well.
We talk a lot on this program with physicians, and we talk to physicians that do fellowships. I mean, technically, it's not really called a fellowship. It's a CHT certification, but it is like a fellowship. I mean, you're training in these very specific upper extremity injuries and treatment of those injuries for several years. So you're an expert in this area.
I like to hope so.
Yeah, we like to have experts, that's for sure. Let's talk about being an expert and some of the things that we're seeing in today's world. And one of the things that we talk about is handheld devices and ergonomics. We have so many people that are on their phones or handheld devices. I mean, the percentage and statistics of people using those devices. Sometimes we have talked about overuse injuries. You know, we at one time BlackBerry thumb and things like that. You know, just different names that we give these injuries. Tell us about handheld devices.
Handheld devices are definitely getting us into trouble. According to a recent research survey, 77% of Americans actually own a handheld device. This is up from only 35% in 2011. So we know we're definitely getting into trouble. We definitely want to decrease the muscular load as we're using these handheld devices. We want to try to alternate hands when we're using them. We want to use our voice dictation when possible. Alternate fingers, using your thumb and your index finger to help lighten that load and keep you out of trouble.
I'm amazed. I mean, particularly, shout out to the teenage population here. I've watched them text on their phone with their thumb without looking at their phone with their thumb, and they're just flying through there. And I'm sure you do that 100,000 times a day. You're susceptible to overuse, tendon sprains or strains, different overuse type injuries.
That's exactly right. We are seeing anything from a tendinitis of the thumb to carpal tunnel and even early signs of osteoarthritis in that thumb.
So hold it. You're talking about osteoarthritis in the thumb at a young age, because we normally don't see osteoarthritis until our elderly years.
We're starting to see evidence of early arthritis, a stage 1 arthritis, as early as 30 to 40 years of age.
More with Carrie McCaffrey and Shannon O'Kelly after this time out on Como.
It's a Northwest Lifestyle Weekend on Como News. Here's Tom Hutler and Shannon O'Kelly with more IRG Health Talk.
More on hand problems with Carrie McCaffrey and Shannon O'Kelly.
So, Carrie, we're talking about your specialty. You're a certified hand therapist, treating and expert in areas of injuries and treatment and rehab of the upper extremity, particularly the hands. And one of the things you were talking about, and we were talking about, is overuse injuries with our handheld devices in today's world. But, these are probably things that you have to catch early, maybe some signs and symptoms that you might be experiencing overuse injuries from handheld devices.
Well, number one, if you're starting to see any signs of pain with use of your handheld device, that is definitely an early warning sign, especially if that pain is lasting 10, 20 minutes after you've used the device. Second, if you have any signs of numbness and tingling, that is definitely an indicator to follow up with care.
So it's pain that is lasting after using the device. And what about any swelling?
Definitely, some people will see swelling along with that pain. Also an indicator to modify how you're using that handheld device and to seek out help.
So if you have a problem with overuse regarding handheld devices, what would you do for that patient? Maybe walk us through your exam, the treatment of, and maybe some of the splinting or modifications that you might put in place to protect that injury or that area of pain.
Well, the first step is definitely a conversation. I want to get to know how often a patient is using their handheld device, how they're using it, and then I want to get an idea of how important it is to them and how we can change the ergonomics, first of all, to help decrease that muscular load. And then we're going to look at the soft tissues. We want to know what is happening and where it's happening to treat appropriately. And then we can work on custom splinting to help decrease that inflammatory response.
So you're talking about custom splinting. I watched you guys work. You guys make some fascinating splints. So what you're trying to do with the splinting technique is decrease the irritation or overuse to that area, that muscle or that soft tissue, so they can still use their device. They're just not overusing the tissue and irritating it.
That's correct. It's going to be our first line of defense to calm all the tissues down. We then follow it up by strengthening exercises to make sure that this problem doesn't happen again. And our whole goal as a therapist is to help a patient self-manage. So if this becomes a problem again, they know the tools that they need to help decrease the symptoms.
And, a lot of upper extremity injuries are overuse or repetitive trauma. So just like an athlete, to prevent those, there is some preventive mechanisms that you can do. Some stretching, some modified activities, maybe looking at your ergonomic station. Like you described, maybe splinting, but also what about like things like, what is a pocket socket, or what's the back of the phone have? There's some things you can put on your phone where maybe you're changing your grip style.
That's right. There are some devices out on the market, including a pop socket or a ring. That's right. Or a ring that you can put on the back of your phone. These will help decrease the demands of having to grip nice and tight and decrease the muscular load.
It's amazing. The world we live in, technology is great, but it also increases, or also we have new injuries on the horizon where you go back 100 years, it was all agriculture based. Now it's technology based.
That's right. We got to it keeps us on our toes.
Thanks, Carrie. Great information.
Thank you, Shannon.
That's been Carrie McCaffrey, a certified hand therapist from IRG Snohomish. Handheld problems because of the handheld devices. We're also typing on irgpedia.com has more information. And I imagine there's new technology for curing or at least dealing with these problems because there's more new problems coming along.
New problems, more technology, a lot of advancements in the rehab, Tom.
We're going to come back with our final segment right after this time out on Como.